vaksin COVID-19. Dan kita terus memberi keyakinan bahawa vaksin ini adalah vaksin yang berkesan, vaksin yang selamat, dan vaksin yang boleh memberi satu sinar di hujung kegelapan yang kita telah mengalami sejak setahun yang lepas dengan adanya jangkitan COVID-19 dan juga dengan adanya PKP dan sebagainya yang telah mengganggu gugat pelbagai sektor ekonomi dan juga sosial negara kita. Dengan itu saya buka untuk apa-apa soalan daripada pihak media.
YB, 5 saja atau lebih lepas ni yang looking forward lebih daripada sektor?
At CITF, we have a unit that looks at private sector and NGO partnership. So we are reaching out to a lot more. We're reaching out to a lot more. There will be many more announcements of partnerships between CITF, the private sector, the NGO sector, and other key sectors that will want to come forward to assist us in this national effort. So I'm very happy that we've started today with five very important partners with us, and I've described the details of the partnership for each of the 5 partners today. And these are the type of partnerships that we would like to activate with others in the future.
Daripada 20%, your expectation after this dengan partnership?
Well, I think the first expectation that we have from all these partnerships is to see an increase in the registration numbers. So all of the partners today have agreed that the first priority for this partnership will be to utilize all their channels, whether the channels are delivery in terms of post and grab, whether their channels are retail, whether their channels are in the NGO sector, whether their channels are through sport athletes who are influencers, to convince and to influence people to register for the vaccination. So the more people that are involved in convincing the public to register, the more counters they see, the more influencers they hear, the more flyers they read, should contribute towards an increase in the registration number.
So I think what is the expectation in the increase, especially in the phase 2, where elderlies have no gadgets, so how it helps?
So for instance, we hope that our partnership with Post Malaysia will be very important. They will be going door to door anyway, delivering post, delivering courier through Post Laju. And while delivering, they've kindly said that it's not going to be extra cost anyway since they're delivering. They will deliver flyers. These flyers will be very important because, as I said, every single flyer, every single booth, every single tweet on social media counts. So for those without gadgets, the partnership with Post Malaysia is so important because the reach is everywhere, and a lot of people receive mail, or if they don't receive mail, they'll definitely receive something in a package or something. And while receiving the package, they get a flyer. You might convince and convert some people to register for the vaccination. Any other questions? Yeah. If there are none here, I'm told that this press conference is also being followed by journalists online. Can I invite anybody who is following us online to ask a question? Hi.
Yeah, this is Shini here from BFM.
Yes, hello.
So I have a couple questions for Post Malaysia, Grab, and YB yourself. So first one for Post Malaysia, do you have a target of how many flyers or households you might hope to reach out to? And do you have a start date of roughly when you want to start this, and how long would it run for? Same for Grab, for the flyer distribution as well, and all the changes to the apps, because you're going to add mapping of these vaccination centers, etc. Is there a date where you intend to launch all of this? And yeah, will these initiatives run until the end of the vaccination program, or if we achieve 80%, like, or is there a target to end? Yeah, and for YB Khairy, are there, for the health NGOs that you're hoping to engage by the CITF, do you intend to look for them to be volunteers at vaccination centers itself as well? Thank you.
Maybe Post Malaysia first.
Secretary here. First of all, we've got about 13,000 people on the ground, and we have about 1,000 outlets or channels in the country, throughout even Sabah, Malaysia, in Sabah and Sarawak, and in the rural areas. We have about 9 million addresses already in our hand. We send about more than 1 million mails a day, and a few 100,000 parcels a day. So we will start immediately. And how some of the programs is actually to help, especially in the rural areas, as YB Khairy mentioned just now. We will help some of the rural folks in registration to MySejahtera. If not, we will also help in the process of registering them in other means in the web page. So we will do that.
Invite Grab to answer the question.
Hi. Yeah, thank you for the question. So Grab Malaysia is really honored to be part of this program and play a role as a digital communications partner. To answer the question, our in-app communication assets will be launched in our Grab app by this week. So what we are doing is we're putting up a banner, an information banner. We're putting up a highly visible feed card as well that links to information around immunization, the importance of it, and how to register, etc. And we feel it's really important to get this out to the masses and hopefully to the millions of users who access the Grab app every day. On top of that, we are also working with the CITF to set up the points of interest, as YB mentioned earlier, the pick up and drop off points mapped to the vaccination centers. So we are working on that. And once that is set up and once the public can access the vaccines, we will work closely with the CITF to ensure that we have safe, reliable, and a very efficient mobility to and from these vaccination centers across the nation.
To answer the question on the involvement of NGOs in the vaccination centers, St. John's Ambulance as well as the Malaysian Red Crescent Society will be involved as volunteers at the vaccination centers. St. John's Ambulance has also kindly offered the use of their ambulances at the vaccination centers, because some of these vaccination centers will not be at hospitals or clinics, but they will rather be at stadiums or halls where we will convert them into temporary vaccination centers. So because of that, we will definitely need ambulances just in case there are any adverse effects that require the person who's been vaccinated to be taken to a clinic or a hospital. So we'll most certainly require support services like that at the vaccination centers. On whether or not NGOs will also be involved in the actual vaccinations, we are already speaking with NGOs such as IMARED, the Malaysian Red Crescent Society, Mercy Malaysia, MSF, Médecins Sans Frontières, on assisting us with the vaccinations at the clinics or as mobile teams, especially for certain key target groups like Orang Asli communities in the interior, as well as refugees, asylum seekers, and undocumented migrants who may be reluctant to come to a government-run vaccination center. So we are discussing with these NGOs and others on how they can assist us in vaccinating some of these key groups, vulnerable groups, and groups which perhaps will be a little bit difficult for us to reach geographically or for other reasons. Are there any other questions online?
Hi YB, this is Ashrita here from Code Blue.
Hello.
Yeah, I have two questions. The first one is on the ground volunteers that are helping register the public for the vaccine. This is in Bangi. So they pointed out that many disagree to register because one, they can't choose their vaccines or they are afraid of the side effects. And only half of them can be persuaded while half of them just walk away. So my question is, what are the other ways that we can convince this group of people to register for the vaccine? And the second one is South Korea has reported that their AstraZeneca supply from COVAX from India has been affected because of India's export ban. So could this possibly also affect Malaysia's supply of AstraZeneca doses, which is coming from SK Biosciences? As I understand that's where our COVAX supply of AstraZeneca is coming from. Thanks, YB.
Yeah, thanks. First of all, on the first question of the report from ground volunteers in Bangi, this is something that has been brought to my attention by the Member of Parliament from Bangi, Yang Mohamad Ong Kian Meng. He's also shared with me the same concerns that some of his residents are reluctant to sign up because they want a particular type of vaccine, they want to choose rather, or they are concerned about the adverse effects or the side effects from the vaccines. Now, we are training more volunteers through CITF, explaining the safety of the vaccine so that volunteers on the ground have material, data, information to convince people that the vaccines are safe. But of course this is very difficult because a lot of people seem to have made up their minds. They don't even want to talk, they just want to walk away. So I think the main thing is to just focus on those who want to talk, who are willing to listen, who are willing to register, and hopefully in the medium term, over the next few months or so, as more people become vaccinated, as the rates of transmission, hospitalization and deaths come down, those who are reluctant will be more willing to come forward to be registered. I think there is a demonstration effect at work here, which hasn't really started yet because phase 1 has largely been confined to frontliners, not to the public at large. But once we start phase 2 on the 19th of April, and we are focusing on the senior citizens, people with chronic illnesses, once they get vaccinated, and once we can demonstrate that there are no serious side effects, and we are clear about the side effects, that vaccination will have side effects. Any vaccines have side effects. Some fever, some chills, pain at the point of the injection, these are normal things. But once people understand that there is no serious side effects, like permanent injury or death, then they'll be more willing to come forward. And more countries are starting to think about the sort of things that you can do once you are vaccinated. So the United States, through the Center for Disease Control, is coming up with new regulations for people who have been fully vaccinated. So even in Malaysia, we are starting to think about what we will allow people who have received a full dose of vaccine, 2 doses of vaccine, to be able to do, compared with people who have not received any vaccination. So once we start thinking about this, looking at the data and announcing it, this will hopefully also be an incentive for people to want to come forward to register and to become vaccinated. So I think the most important thing right now is communication. Yeah, it's not to panic and worry that half the people are walking away. It's to rather continue to communicate with those who are willing to listen and to be confident. And I am confident that the more people are vaccinated, more people who are registered are vaccinated in the coming months, then those who are reluctant will also come forward to say that, yes, I believe that the vaccines are safe, I believe that the vaccines are effective, my friend, my family member has already been vaccinated, They seem to be doing well, and I want to be safe as well. So I think this element of wait and see will hopefully resolve itself. So for now, I don't think we should force people or have a deadline. It's still continuous engagement, risk communication to the public. On the question of the vaccine supply from Serum Institute for AstraZeneca through COVAX, our AstraZeneca supply from the COVAX facility comes from the manufacturer in Korea, which is SK Bioscience, and it doesn't come from the Serum Institute. So while we are still waiting for the delivery details from COVAX for AstraZeneca to Malaysia, I don't believe that the ban from India will affect us, because our vaccines come from SK Bioscience, unless there is something to do with the supply chain there, which I'll have to look into. But as far as I know, it shouldn't affect us. But I would also like to update everyone that I received the delivery schedule for AstraZeneca, not from COVAX, but direct from AstraZeneca today. Just received from AstraZeneca Malaysia, and this is from the AstraZeneca contract manufacturing plant in Thailand, where we will receive our AstraZeneca vaccines from. So I have confirmation that the delivery of AstraZeneca from AstraZeneca, as opposed to from COVAX, this is the direct procurement, will commence in June, where we will receive our first 600,000 doses of AstraZeneca from AstraZeneca in June. And the deliveries will come subsequently every month. Any further questions? If there are no further questions, I'd like to once again thank our partners for being part of this event today. And I believe that through the partnership with Parkson, Post Malaysia, St. John's Ambulance, Grab, and Living Minds, we will contribute towards greater vaccine confidence and increased registrations from Malaysians. Thank you very much. Are we done?